Did you know that diabetes is going to be to the extent of 366 million by the year 2030? And out of that, more than 50% will be in India. So in a high blood sugar case, the testosterone level also goes down. Testosterone is the male hormone that is very important for sexual function, including erectile function. Did you know that diabetes is going to be to the extent of 366 million by the year 2030? That's a global prediction. And out of that, more than 50% will be in India. India is going to be the global capital by 2030. I think, to my mind, it is already a global capital for diabetes. With so many persons have suffering from diabetes, it is important to talk about the sexual effects diabetes has on the body. In fact, more than 50% of the persons suffering from sexual trouble, the cause is diabetes for a start. It's not as if the association between diabetes and erectile dysfunction has been found out today. It has been known since the 17th century. And that's what the West says. But I'm sure in the 5,000 years ago, in the time of Vatsayana and the other great sexual gurus, it was well known even at that time. And there were remedies that were prescribed even at that time. One point that is to be noted is that not only is the diabetes a cause of erectile dysfunction, but you give anti-diabetic treatment. Even that is responsible for increasing the erectile dysfunction morbidity. So you have diabetes, you are in trouble. You treat diabetes, you are in trouble.
अगर हम करें तो करें क्या, बोलें तो बोलें क्या?
It would be nice not to have the disease at all, but once it occurs, then we have to take precautions. In patients suffering from type 2 diabetes over the age of 40 years, erectile dysfunction occurs in more than 65% of cases. With this huge number, it becomes important to know what we can do to prevent the erectile dysfunction. One thing we have to understand is that diabetes is a lifestyle disease. Therefore, lifestyle modification is an important and integral part of the treatment. So what is the cause of this high prevalence of erectile dysfunction in diabetes? You see, diabetes is a disease that affects almost all the organs of the body. The muscles are affected, the nerves are affected, the arteries are affected, hormonal function is affected. And what is important is the duration of diabetes for these comorbidities that occur. In case of erectile dysfunction, the arteries get deposit of cholesterol inside the inner lining of the arterial wall, which is known as the endothelium. And this deposition of cholesterol progressively narrows the lumen of the artery till at some stage the artery gets blocked. So the blood supply to the penis becomes less, and therefore person doesn't get a proper erection. This is one way in which diabetes acts. The other way it acts is in affecting the nerves which supply the penis. These nerves carry with them the neurotransmitters which enhance the flow of blood to the penis. Now, when the nerves are destroyed or affected, the neurotransmitters or these hormones cannot reach the penile vasculature, and therefore the blood flow to the penis is again reduced. Not only that, diabetes affects the testosterone level, which means that the effects of testosterone at the central level, including desire, are reduced, and at the peripheral level, where it acts on the musculature, that again is affected. So diabetes acts in four-pronged attack, which is it affects the arteries, it affects the nerves, it affects the musculature, it affects the hormones that are acting on the penis. And now you can imagine why this is such a dreaded disease and why erectile dysfunction is one of the earliest events to occur prolonged diabetes. There are other instances also where erectile dysfunction has led us to diagnose that the patient has got diabetes. So in many cases, the patient can present with erectile dysfunction and he's actually got diabetes as the cause of this erectile dysfunction. Listen to what the penis is saying. If a person takes adequate precautionary measures, goes to the doctor the moment he has erectile dysfunction, and the doctor is clued on, he will probably get a heart profile done and a diabetic profile done. And in many cases, we are surprised to find that these parameters are deranged and they are the cause of erectile dysfunction. This is where the erectile dysfunction acts as a symptomatology and not as a disease. Fortunately for us, there are medicines that are available, including Viagra, which are very effective in cases of diabetes. And more than 60% respond to these medicines, which are known as PDE5 inhibitors. They are all group of drugs which act in a similar way, including Viagra, and they are pretty effective in cases of diabetes. If they are not working, then maybe because the diabetes itself is out of the range, and then you need to get the diabetes corrected. And one other very significant feature is that if the diabetes is controlled, the testosterone level goes up. So in a high blood sugar case, the testosterone level also goes down. Testosterone is the male hormone that is very important for sexual function, including erectile function. So once you control your diabetes, you not only control the disease process itself, you also control the hormone level, which increase as a result of decreased diabetes in the body. So the conclusion that I want to make is that diabetes and erectile dysfunction are very common occurrences, particularly after 40 years of age. Lifestyle modification is one of the ways of preventing both erectile dysfunction and diabetes from becoming prevalent. And what are these lifestyle changes? I'd like to refer you to one of my earlier videos on this issue. Basically, they consist of diet changes, regular exercises, quitting smoking, avoiding alcohol, having regular sleep, and so on. These are all important to prevent a sexual dysfunction as well as diabetes. And if you follow these guidelines, then you'll find a distinct difference in your health. It's not as if that there are only drugs that need to be given. Drugs in association with lifestyle changes help the situation much more than just relying on medicines, which again may give rise to erectile dysfunction as a side effect. If you've liked my video, press the like icon. You may send me your suggestions, your ideas, or your opinion on the consent section in the comment section. And please don't forget to press on the subscribe button. It'll help me make more videos of this kind for general use. Have a great day.